Good evening to all of you, and thank you for joining us on 13 Plus. I'm Mary Coleman. Let's jump right into your story for this evening. Well, as we know, we have heard about the increase in ransomware attacks that can target financial institutions, utility companies, and now even hospitals. When these attacks disrupt services at hospitals, it puts lives at risk. As our national investigative team discovered how bad the problem is getting, they also discussed what's being done to keep you safe.
The healthcare industry faces a ransomware epidemic, and according to industry leaders, it's putting lives at risk. An analysis by a cybersecurity firm found in 2023, 46 hospital systems suffered ransomware attacks, up from just 25 the previous year. Dozens of hospitals were directly impacted and experienced disruption due to the lack of access to IT systems and patient data.
Ransomware, according to IBM, is a type of malware that holds a victim's data or device hostage, threatening to keep it locked or worse, unless the victim pays the attacker.
And it's not just computer systems that are threatened. Health news website Stat says hospitals are forced to treat fewer patients during ransomware attacks, and they provide less care for the patients they do treat.
Reporter Kristen Crowley digs into the surge in ransomware attacks against health systems and what's being done to keep you safe.
It happens to local governments.
The cyber attack to Fulton County is indeed a ransomware incident.
It happens to school districts.
It is serious. It's very serious.
It's called ransomware, a type of malicious software that allows cyber criminals to take control of systems that access private information and hold them hostage until a ransom is paid. An attack can leave innocent people susceptible to identity theft. But when ransomware targets hospitals, that can have life-threatening implications.
Take my information, but I want my kid okay. Take all my stuff. Take my stupid credit cards and my stupid social security number. I don't care.
It was October 2022. Kelly Parsi had to bring her then 3-year-old son Jay to the ER in Des Moines, Iowa. He was dehydrated after a recent tonsillectomy. She took him to the very hospital he had that procedure done. But something was off.
They started asking us all these questions. They wanted to know when his surgery was, where it was at, who the doctor was.
Did they say why they were asking you all these questions?
So I asked them, I said, what in the world, what's going on? Because they were writing everything down on paper too. And the guy said, our computer system is down.
But it was so much more than that. The hospital was in the midst of a ransomware attack. What happened next still brings Kelly to tears.
She just had like this big syringe of Tylenol and gave him Tylenol. And then the pediatrician came in and was like, hey, I need to talk to you. And he was like, we overdosed your son. We have a Narcan on the standby. I can't even talk.
Jay received too much Tylenol with codeine. Kelly says the confusion due to the ransomware attack and lack of access to Jay's records, like his weight, led to the mistake.
I'm like sitting there like holding him, and I'm like, please be okay, like stay awake. And then at that point I was like, we gotta get out of here. Like they're gonna kill him.
And Kelly's experience is exactly why experts say ransomware attacks on health systems are so serious.
Are people's lives at risk?
They're absolutely at risk.
John Riggi is the National Advisor for Cybersecurity Risk with the American Hospital Association. He says during an attack, not only can an entire computer system be shut down, but hospitals can lose connectivity to important medical devices.
For instance, a CT scanner may not be able to transmit the image of a stroke patient to a remote radiologist or to the operating room.
What happens when medical professionals can't get access to those results?
So it becomes pretty difficult. So if it's a serious case of a stroke, heart attack, or trauma, that usually causes the diversion of the ambulances in those type of cases to other facilities which are not impacted.
And Riggy says the problem is growing rapidly.
We're seeing about one high-impact attack every couple of weeks.
A report from the University of Minnesota School of Public Health found from 2016 to 2021, ransomware attacks more than doubled. And since 2022, the U.S. Department of Health and Human Services Office for Civil Rights has hundreds of IT hacks on healthcare providers it's investigating. Experts say one reason for the spike could be because health systems are more likely to pay the ransom, since lives are at risk.
It's the same as having a digital gun to your head in a sense. They're paying under duress for patient safety reasons.
Once a hospital has become the victim of a ransomware attack, what happens to how that facility functions?
Well, really, they're kind of taking it all the way back to the days of pen and paper, right? So a lot of those ransomware attacks are taking and then locking up their critical systems, some sort of encryption key where you can no longer access them.
Lindsay Reinhardt is the chief operating officer at cybersecurity company INE. She says there are two main ways a ransomware attack happens on a health system. Either cybercriminals have found a back door into their systems, or they've tricked an employee into clicking on a malicious link through an email that exposes the virus into their network.
How do these hospitals and health systems protect themselves?
Training has been proven to be one of the most critical needs.
And Riggy, who worked with the FBI for 30 years, says the federal government is also stepping up to combat these attacks.
The FBI in particular and Department of Justice now prioritizes ransomware attacks against U.S. critical infrastructure the same priority level as a terrorist attack. And the FBI has been very responsive in responding to hospital ransomware attacks.
That help, he says, is key for healthcare.
Mine is Level and Marshall.
Luckily for Jay,
He's doing so good. He's such a good kid.
he has no memory of the overdose and is happy and healthy today. But Kelly says she's forever changed. She now keeps extensive records herself when Jay is sick, monitoring his medication and always questioning doctors, something she says other patients
Can I have a kiss?
might want to get in the habit of doing too.
This is Des Moines, Iowa. There's nothing. I mean, we're such a small community and it's happening here. It can certainly happen anywhere.
We reached out to the hospital in Des Moines that Jay was treated at. It declined to comment about the ransomware attack. In late February, U.S. Attorney General Merrick Garland announced the takedown of a notorious ransomware group called Lockbit, known to target health systems across the world.